and I hope that you enjoy this course. And now this is time for the exam. You have a quite long time now, uh, you know, approximately 1 month. You will come back again, and then you have this final exam. This is the schedule which I have already shared. As per your request, your first exam is going to be on Tuesday, 8th of April. This is MCQ. Then we have on Thursday, you have another exam that is your MEQ and EBM. And the next week, you have OSCE 1 and OSCE 2. OSCE 1 will be on 13th and the OSCE 2 will be on 14th. OSCE 1 is your basic science and OSCE 2 is your clinical science. So is this clear with everybody? The schedule is clear for all of you? You can hear me, right?
Yes, yes.
Yes.
Yeah. So this is the schedule. Last year we had OSPE for day one. We had for the basic science like anatomy, histology, and pathology. We had OSPE, but the review and we received from you, and based on our last year review for this OSPE, most of the students they don't want the OSPE, and so we decided to go with the OSCE as per your request and your wish. So this is the schedule. What I request from you that now today is the last date. You finish this module, so you know you should concentrate more on your study now. This is enough time for you to do well in the final exam, and I hope all of you will do well, inshallah. So this is the schedule for your exam, and how we are going with this. Now, what we are going to have it in the MCQ. MCQ is consisting of 60 questions, 60 MCQ questions. And this is total going to give you 20 grades, 20 marks. And the MEQ again will be 15 questions. Each question will be consisting of two sections, A and B. And in each question, you'll have about 5 questions. Mostly enumerate, some matching question might be asked, some definition might be asked, some fill in the blanks might be there. But mostly the question will be the enumerations. So, this is little difficult for you. So please concentrate how to approach this MEQ paper. Although it is just 10 marks, but it is important for you to write the answer correctly. Sometimes you get confused and you write, despite knowing the things, you write, not the right things, and you end up losing the marks. So this is important exam, MEQ, and the blueprint for both MCQ and MEQ exam will be the same. So if you read it for the MCQ, you can also answer the MEQ. The only difference is that the MEQ questions will be like multiple choice questions. You know the options, and then you can choose one option. But in MEQ, you have to enumerate like what are the branches of the lumbar plexus. So you have to write the branches of the lumbar plexus, 3 branches or 5 branches, or maybe questions like the name of the lumbar plexus branches will be written, and then you have to write their root values, say like the femoral nerve, obturator nerve, lateral femoral cutaneous nerve, and so on. And then you have to write the exact root values for these nerves. Similar type of question may be like the distributions. So they'll ask you to they'll give you the name of the nerves, and they'll ask you what exactly it supplies. So it is like a fill in the blanks, or maybe like you have to write. So for like femoral nerve, they'll ask you write uh, three muscles that are supplied by the femoral nerve. This is what I'm giving you are the examples. So different types of question might be asked in MEQ, like say MCQ, like enumerations mostly, but you may have fill in the blanks, matching, and even you might get definition in 1 or 2 questions. So this is about MEQ, and with the MEQ, We have the EBM also, like you know about it. This is written OSCE exam. So you'll be given half an hour for EBM and 1 hour for your MEQ exam. So this is the theoretical exam. These are the theoretical exam for paper one and paper two on Tuesday and Thursday. Remember that this is immediately after we come back from the vacations. This is on 8th and 10th of April. So just make note of it that you should come well before the time, and you give the exams in the right way. So these are the theoretical exam, and then next week still you have time, like on Thursday, then you have Friday and Saturday. So what I suggest that once you finish your paper two, that is on Thursday, 10th of April, by 11:30 you will finish it, and you have a chance here to look at the models in the anatomy lab, both in the male and female side, uh, different kinds of model, because after this we'll not be able to open it for you, because we have, immediately after this on Sunday we have exam and on Monday we have exam. So if you want it, you can have, you can visit the lab and you can explore the different models for anatomy and so on. And you can still come to us on Wednesday if you wish to do so. Like Tuesday, you have exam MCQ. If you want to come on Tuesday, also you can come. And if you wish to visit us on Wednesday, also we can open for you the lab. So Tuesday, Wednesday, Thursday, these 3 days are for you. If you want to come to us to the lab, you can. And then the next week we have two very important exam. You know about it, OSCE 1 and OSCE 2. Uh, the total marks for the OSCE is 30. So 20 is from your MCQ, 10 is from your MEQ, and 30 is from your OSCE exam. We have 10 stations. One is EBM, that is written OSCE station. Then we have 9 stations on day one and day two. So what are the stations? I'll let you know about in a short while from now. So okay, so this is your OSCE blueprint. Uh, so what do we have? We have about 3 anatomy stations, one histology and one pathology station. This is I'm talking about day one. So on day one, we have anatomy, histology, and pathology. How many rooms we are going to use? We are going to use 3 rooms, and in the room one, we have a station one and a station two. That is your upper GIT and the lower GIT. So the GIT will be 2 stations, station one and station two, and that will be in one room. So each station will carry 3 marks. That is 10% from here. You can see, and the duration of this station is going to be 3 minutes. 3 minutes for all the stations on day one. So what do we have in upper GIT, lower GIT? You can go and see the skill list, and you know with the upper GIT and lower GIT, we have radiology also. So what will be the questions from the upper GIT? Now, I repeated, yani I told you before, I repeat it again, that you go through the skill list and go through your workbook. Anatomy workbook is very, very important for all these 3 stations. We'll mostly concentrate on the workbook. Yani there is a skill list and then there is a workbook. So we have 3 stations of anatomy, upper GIT, lower GIT, urinary system. Now, this urinary system, along with that, you will see that we also includes the posterior abdominal wall. So don't say that this is not there. So in urinary system, we have kidney, ureter, urinary bladder, and then we have the related structures like the posterior abdominal wall and so on. So this you can see it in the skill list. And you can see that we have radiology in all the stations of anatomy. Anatomy 1, 2, 3, you will get the radiology. So these all stations are 3 minutes. In room 1, we have 2 stations, station 1 and 2. And then in room 2, only we have 1 stations, that is urinary system plus radiology. But again, the timing is 3 minutes. So the examiner will stop you in 3 minutes, and the 3 minutes you will have the rest. Then you will move to the next room. And in the next room, we have 2 stations. One is histology and one is pathology. So again, histology will be mainly from the GIT, the urinary system, and the endocrine system. The pathology is mainly from the GIT, the urinary system. This you can see it in the skill list. So again, these 2 stations are 3 minutes, and this will be in 1 room. So total on day 1, we are having 3 rooms and 5 stations, and we are going to have 2 rest stations on day 1. So this is on day 1 now. Uh, the student used to ask me that uh, for anatomy, what kind of the resources we are going to use in the exam. Is it the models or is it the images? Let me make it clear for you that for some stations, you might get it if we have, like, say, uh, some station, you might get the models, and otherwise, mostly, because we are going to have 4 panels in the male side and 4 panels in the female side, we want to make it uniform. So if we are going with the models, we'll go with the models in both side, male and female side. And if we'll go with the image, we'll go with the same image in the both male and female side. So exam will be uniform. So you might get models and you might get the image. From where we are going to use the image? The image will be mostly from the lectures or the workbook, mostly from the lectures which are given to you. So, you can concentrate. The image will be color images and it will be clear to you. You know the structure very well. So you can answer it easily on that. So this is for anatomy. In radiology also, you will get the image and then you will be asked to identify the structures, or this is, from your radiology lecture. Radiology image will be, of course, black and white. So you might get a different types of radiological image, which may be your plain X-ray, CT scan, or whatever is given to you. So this is on day 1. Regarding the histology and pathology, yeah, most likely you will get the images which has been given to you in your practical session or in your lecture session. So here I just want to clear it that image might be from the lecture as well as might be from the practical session which has been given to you. Now, what kind of question will be there in the histology and pathology, especially in the pathology? Is it just identifications? No. You'll have some skill questions like identify the slides, and then there will be follow-up questions. There might be some clinical scenario for pathology, like the patient is there and the patient present with these symptoms. What is your diagnosis? And look at this histopathological report and make your diagnosis. So, for example, if there is a BPH, they'll give you one clinical scenario. You will read the clinical scenario that this patient, male patient, 65-year-old, presented with obstructive symptoms. You did the biopsy and the histopathological report is there. Please look at the histopathological slides and take your final diagnosis. So this is like, you're making the diagnosis, you will get, if you answer it, okay, this is benign prostatic hyperplasia. So you will get, and then they'll ask you in the slide. So what you can see different in the slides like A, B, C, D, and they'll ask you what are these things in this. Similar to like the prostate question, maybe from thyroid or from the GIT. So you might expect, you might get it. The scenario, you have to you have to read the scenario, you have to answer the questions, and then you have to look at the pictures which will be given to you and answer the questions carefully to the examiners. The examiners are not going to tell you that whether you're right or wrong, and this is not ethical to ask the doctors or the examiner that whether I am right or wrong, because you're right, and if you're wrong, you're wrong. The examiner are not supposed to tell you that you are not right. So please make sure that your answer is right, because you say BPH and it is something else. So you will lose the marks. So please make sure if the question is asked like this, you have to be ready for this. So this is day one. And the next day, we are having four stations, two integrated stations and two consultation stations. Now, integrated station, you will have one station is about the abdominal examinations. So what abdominal examination you will get it? The instruction will be given to you that what exactly you have to do. For example, if they ask you to examine the abdomen of the patient, then you have to examine the abdomen of the patient in the classical way. You have to do the inspection, palpation, percussion, and auscultation, even the general examination. You know about it. But if it is written that do the palpation of the patients, then you have to do the palpation only. Don't go for the auscultation and whatever is not asked. So do whatever is asked in the questions. So be you have to be vigilant to look at the you know question, what is being asked in the question, and then you have to do exactly the same thing. You might get a scenario that there is a patient who comes to you with the yellowish discoloration of the sclera, and you are asked to examine the patient liver. So now they are only asking you to examine the liver, so you know how to examine the liver. So you have to do that only. So if it is not asked, the question is like examine the abdomen of this patient. So you have to do in a classical way. And very important is that you have to demonstrate that in the examination you have to first wash your hand. Wash your hand. Um, Even if it is not, if it is not provided to you, that then even you have to imitate that you are washing. You wash your hand, and then you will examine the patient. You will introduce yourself. You take the consent. So these are the very basic things while you are doing or performing the examination. For examination, we are mostly going to use the mannequin. So we have mannequin for abdominal examination as well as mannequin for the thyroid examination. So you know how to, examine on the mannequin. So it should be, very clear where you should stand on the right side, what you should do, how to, communicate with the patients. So these things, about the examination. And this is the clinical part because this is integrated station. So the clinical part is about the abdominal examination, and in the anatomy part, you will get the anterolateral abdominal wall plus the liver. Anterolateral abdominal wall, you will get the image, um, and then on the image you have to identify uh, like say the different quadrants of the abdomen, maybe the muscles, the different layers in the anterolateral abdominal wall, and the anatomy, like say some of the important areas. So this is there on the anterolateral abdominal wall. You might be asked to uh, demonstrate something on yourself uh, on the anterolateral abdominal wall. Along with the anterolateral abdominal wall, there'll be a liver also, because this is there in the blueprint. So in the liver, first of all, they might ask you to identify the different lobes, like right lobe, left lobe, quadrate, and quadrate lobe. And there is one more important thing, that is the anatomy of the liver. So
Doctor, there's no voice.
Okay, can you hear me now?
Yes.
Yeah, thank you. So I was talking about the stations on day one and a station on day two. So we finished with the day one. We have three anatomy stations and one histology and one pathology station. On day two, we have two integrated stations and two consultations. On integrated station one, we have abdominal examination, and along with that, we have anatomy, and the anatomy includes the anatomy of the anterolateral abdominal wall and the liver. And in the abdominal examination, you will get the instructions what exactly you have to do. You might get a classical abdominal examination. We had you have to examine the abdomen of the patient in the classical way. You have to wash your hand, take consent, and then do the inspection, palpation, percussion, and auscultation. So this is one way. Another way is that you'll be given an instruction that you have to do a particular things, like say you just have to do the palpation. So you have to do whatever is asked in the exam, not like say if you're asked to do the palpation, then you have to do the palpation, not to do the auscultation and another thing. So please make note of it that you read the instruction carefully. So this is about the abdominal examination and anterolateral abdominal wall and liver. In the anterolateral abdominal wall, you will get a picture, or uh, in the picture you might be asked to locate the different quadrant of the abdomen, the different muscles, and then there might be a follow-up questions like what artery and what is rectus sheath and so on. And similarly in the liver, you might be asked to locate the different lobes, different structures, and there is like anatomical lobe and surgical lobe that we used to call as conoid segments. So please make note of it that what is a conoid segments. We have 8 surgical units in the liver. So this is there in integrated station 1. In integrated station 2 is about the thyroid examination. So again, you are going to get the mannequins for both these examination stations, abdominal examination and the thyroid examination. So you know how to examine the thyroid. You have to go back and then you have to examine the thyroid. So uh, just the instruction will be there. You read the instruction and start the examination. The same thing, you have to wash your hand, take consent, and then you examine the thyroid. Along with the thyroid, we have also anatomy, because these are integrated stations. You will get anatomy of the thyroid plus pancreas or plus adrenal. So these are all endocrine glands, thyroid, pancreas, and adrenal, that will be along with the thyroid examination. You might get one, you might get two, or you might get all. But if there is a thyroid, they'll ask you question from thyroid or related to anatomy of the thyroid and pancreas and adrenal. So all the anatomy from these three endocrine glands, thyroid, pancreas, and adrenal, along with the thyroid examination. Now, uh, then we have two consultation stations. One is from the medical and one is from the surgical. So in one consultation, like say we have three scenario. One is gastro, one is endo, and one is urological and renal problems. So you'll get two consultation stations, similar type of consultation stations, one from either from these four things: gastro, enterology, endocrine, urology, and the renal. So you know about the consultation. These are very easy stations, very high scoring stations. You know the process. It will be very easy for you. And in the consultation station, you might be asked to write the prescription. So I'll let you know. Some of the students, they wanted me not to have the prescription for these stations. So I made a request to the exam committee not to put the prescription. So I'll let you know. I'll update you that whether we have prescription attached to these consultation stations or not. But for now, let's see that this is consultation, and you might have to write the prescriptions. I'll get back to you very soon, inshallah, and let you know about that. But these two stations are very, very high scoring. If you know the things, you know the steps, you know the Clarke Cambridge framework, it is very easy and you can score very good marks. So on day 2, we are having 4 rooms. Each station will have 6 minutes to answer the questions, and 4 rooms and 1 rest stations. So these are your nutrition and metabolism OSCE blueprint for day 1 and day 2. I have already shared with you the skill list. Go through the skill list, go through your workbook, and try to read as much as you can. Regarding the skill list, some students, they are asking that whether the question will be from outside the skill list or not. Remember that these are the skill list. You might have question outside from the skill list from knowledge-based questions. That will be from your workbook or from the anatomy. So whatever is given to you in terms of the lecture, the practical, the workbook, that all might be asked for in the knowledge-based questions. So in the OSCE, you have the skill as well as you have the knowledge-based question. So there'll be like say the identifications of some important structure, and the follow-up question will be based on the knowledge. So in OSCE also we have 2 different kind of question. One is your skill-based question, and then the follow-up question from the knowledge. So just remember that whatever is being taught to you in this course might be asked in the OSCE also. One in the skill form and might be in the knowledge form. So these are your OSCE exams on day 1 and day 2. And these are your duration of these things. Now, these are the final exam: 30 for the OSCE, 20 for the MCQ, and 10 for the MEQ. So these all together 50 marks. And then you have 10 marks PPL assessment. You know about your PPL assessment already. We have disclosed it, and all of you have a very good marks, more than 9.5. Some of you missed some 1 or 2 sessions, so you got less marks. And then we have EC's logbook submission, and you have to submit it by next Thursday. And it is, online submission. I have sent 2 files today to the leaders. One is your for the females, and one is for the male students. So those who submitted, please sign on that EC submission, EC logbook submission attendance. So make sure that you submit it and you keep the hard copy with you. We'll may ask you to bring it when you come back for the final exam. So you have to submit the same EC logbook. So don't do anything after you submit it. You submit it, you finish it. So we'll review all this logbook. We'll see how many you attended, or is there anything missing from your logbook, and you will be given the marks based on your ECE logbook. So this is by next Thursday. You have to submit it. Submit it to the leader, and the leader will submit it to the EC coordinator, and we will check it. We will review all your EC logbook. So you will get marks based on your logbook assessment. So 10 from the PBL assessment, 10 from your logbook assessment, and then you have had the quiz exams, quiz 1 and the quiz 2. So this is what we have. But remember that we have 60 marks from the final exam, 30 from the OSCE, 20 from the MCQ, and 10 from the MEQ. So these are big chunk of your grades that is going to decide your what final grades you are going to have it. And you have now enough time if you want to really improve on your final exam performance in this nutrition and metabolism. You can utilize this 1 month, approximately 1 month. And I think it's enough time to have a very good result in your nutrition and metabolism exam. So this is a small review for your final coming exam. We are there for you to help. If you have any questions, you can contact me, contact Dr. Naveen, Dr. Radha, and any of your tutors if you want to have any questions regarding the anatomy, histology, pathology, and clinicals. So you are welcome. If you want to ask us anything, anytime, you can ask us. There is no problem. We are available for you for your this exam. Now, if you want to ask me or to Dr. Naveen any question, you can ask me now. And before your final exam, like say your first OSCE exam will be on Sunday, so we might have some orientation on Saturday evening. So how the exams are going to be, what cycle and what panel you'll be there. So we'll also again give you the brief that how you are going to have your final OSCE exam. So these exams are very easy, not very difficult. The only thing is that you have to be focused and you have to read from the blueprint that what are the things going to be asked in the exam. So this is first orientations about your upcoming exam. You want to ask me now, you can ask me if you have any questions now. If you don't have any question now, you can still ask anytime later. You are welcome to ask.
Doctor,
Yes.
what are the stations that are together in the first day?
Yeah, first day we have 3 anatomy stations, one histology and one pathology. This is on day 1. These are all OSCE. And day 2, we have 2 integrated examination station and 2 consultation stations.
You said the first day has 3 rooms. That means
Yeah, okay, fine.
yeah.
3 rooms, Yani. In room 1, you have 2 anatomy station 1 and 2, because these are 3 minutes. Okay, so there will be one examiner with 2 station 1 and 2, that is upper GIT, lower GIT. In the next room, you have station 3. This is urinary system, and this is again 3 minutes, but you'll have 3 minute rest. You can, you finish the exam in 3 minutes, and then you can go to your in room 1 with 2 station.
Doctor, Doctor, we can't hear you.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
دكتور سيد بيعتذر مش عارف يدخل تاني. تمام. لو عندكم أسئلة ممكن على الخاص إن شاء الله مع الليدر يسألوه. شكرا وبالتوفيق إن شاء الله.